Hi everyone. Hi everyone.
Bipin Bora.
Welcome to Mental Care India.
Sorry, Bipin. Sorry, I'm extremely sorry. Although I'm technically very savvy or man who does Zoom meetings with everyone. This time I'm using an iPhone 10, which is quite latest edition of iPhones, and I do a lot of meetings. And Rajni is doing such noble work, a noble piece of work, I would say, a woman of greed, gumption, and valor. She's supposed to ask me some questions, and you can ask me too.
Yes. So before we start asking the questions,
Yeah.
I just wanted to introduce about you to the people
Yeah.
watching. So everyone, we are starting this new series of episodes to invite
Okay.
some guests from different fields to talk about mental health, the importance of an overall well-being, and what you should be doing, how to take care of your mind and the body. So this is the very first episode where we got Mr. Rajesh Bhujle. So here is a short
Yes.
intro about him. He is the owner of Diction School. He is a language consultant to actors like Sri Govinda, Sri Rajpal Yadav, Sri Pankaj Tripathi ji, and many other actors.
Correct.
He's also
Correct.
a buyer and seller of antiques. And as a life coach, he addressed 2,000 women entrepreneurs in Dubai in 2021.
Yeah.
So he walked
Right
on
from a
ramp.
5-year-old kid to an 80-year-old woman, let me say.
Amazing. That's nice.
Now, my present student, she is 80 plus.
Wow.
So I'm teaching her life, what life is, how she should be living life. Because at 80 plus or something, uh, people they are in a turbulent state of mind because
Hmm.
when they don't have anyone, like everyone is, there
Hmm.
is nobody in the family. She lost her youngest siblings.
Oh.
Well, I mean, then there is a problem. You see, when you are single, alone, you don't have anyone. You have money, but then still you have a problem that you are living life with some sort of hollowness. All right.
Hmm. 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 Hmm.
Yeah. Go ahead.
I see. So you have any story of your own, like during your childhood, maybe when you were young, did you find any
Yeah.
difficulty in terms of either mental health or physical health or something? If yes, then would you like to
See,
share?
should I tell you one thing? Life is full of triumphs,
Mm-hmm.
trophies, and turmoil. What did I say? Life is full of triumphs, trophies, and turmoil, and that's a merry-go-round.
Hmm.
So, first, when you're young, you have some, you have a lot of hopes from your life. You have some goals, like
Hmm.
I want to become rich man, or I have to hit a certain career mark, or I have to
Hmm.
hit some mark. I have to. You see a void. You see a career, then you see a marriage, then you see a family. So between 20 and 30, you're more, I would say, more into a world of illusions.
Hmm.
When you're on the wrong side of your 30 or 40, you start thinking that life is now well settled, right? Like I
Hmm.
have my kids, I have my family. If you are having a family, I'm talking about people who have families. But once you cross 50, there are issues like you have the knee pains, then joint pains, all sorts of pains. So I feel the people who are enthusiastic in a young age, they're like a rubber ball, right? You take a rubber ball in your hands, right? Bounce it.
Hmm. Hmm.
The bouncing will be, regular. It will be high. But as the bounce will go, as the age progresses, the bounce will go down. Correct? Yes or no?
Yes, yes, true.
The same thing happens with people of 20, 30, and 40. They have goals, desires, they have sort of career, they're career oriented. But once they cross 40 or 50, they're confused between the career, life, what is life exactly speaking, And if you ask about my life, I started my career at the age of 17. So I used to work for a bank that was NKGSB Bank, North Canara Gaud Saraswat Cooperative Bank. That I was a clerk in that, and I used to work under Earn and Learn scheme. And you know what was my stipend? It was 350 rupees, and I used to write 48 supplements within those 3 hours because there were two staffs, one for the morning, one in the evening. So before the evening staff used to enter, I used to complete 48 supplements and I used to get 350 rupees as a stipend. So
Hmm.
those were the days of 1988 when I was a young kid of 18-year-old. All right. So although there were difficulties, but there was some sort of, career, some sort of youthfulness, and although money was less, but there was more happiness. So when I started my business or bureau, you may say, because I started teaching people. So if you listen, when there was no Speak Well Academy, there was no Vita. These are some of these academies. There was no finishing schools where people teach you etiquette and manners, how to talk, how to stand. That's called deportment in English. Then the accent training. So I was very new. I was novice in those things. But then I collected books, and I was being insulted by one of the members of the family because I was from a vernacular medium. I'm born and bred from a vernacular medium. So I was being teased, I was being trolled. Now, what you call trolling, that's I was trolled, see, on my lacking of English. So, lack of word power. I could not communicate with people, and my communication skills were very poor. I was weak at vocabulary, and I could not utter. Uh, I was not fluent at all. But then I hired an English teacher. His name was Mr. Paul Taylor. So he was MA in English and MA in history. That man taught me. I took my education from Mr. Paul Taylor, and I learned Southern accent. And then I developed a course for everyone that life for a journalist, the course has to be different. For a common man, communication with only day-to-day communication is very important. For business, there has to be different English. Okay, if you go to a restaurant, if you're a pilot, your English has to be different because we use certain phrases, expressions, appropriate expressions, and I always suggest people that uh, they should be using not one book, they should be reading novels like James Hadley Chase on thriller, then Sidney Sheldon, then I would say Agatha Christie, then you have W. Somerset Maugham. So once people start, because reading habits are very important,
Hmm.
and you need to read times newspapers like tabloids and broadsheets. So in our times, I used to read Times of India aloud. So success is a ladder. It is not an escalator. सक्सेस एक सीढ़ी है जो आपको चढ़नी पड़ती है। अचानक आप एक दिन में आप कुछ नहीं कर पाते, बहुत बड़ा आदमी नहीं बन पाते।
Hmm. Right.
सवाल
Good to
पूछिए।
know about your story. You had some difficult times,
And
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 I.
and it is
Okay.
very interesting story,
I
you know.
got
Uh,
Okay. I'll tell you something very personal story of mine. Why people call me a life coach. What's your good name, Professor? You said?
My Bitupan.
Mr. Bitupan Barua.
Huh?
Mr.
Mr.
Bitupan Barua.
Barua, you can call Barua.
Full name?
Bitupan. Bitupan is my name.
Okay. Okay. So, gentlemen, see, I got married at the age of 31. Okay.
Hmm.
And when I got married, it was a love marriage. My wife was hardly 19. It was a love marriage. And we were living the happiest days of our lives, you may say. Because when you marry a woman of your choice, whom you adore, whom you love, then everything around you find is, uh, I would say, hilarious. Everything sounds like, because you are in a flow. You feel like you are in a paradise, because when your every wish starts getting fulfilled, you feel that you have hit the Rubicon, or you are at the top of the world. You're on the top of the world. But then one fine morning, when my baby got delivered, it was a 5-month-old baby, and I heard the news that my baby is not keeping well. I took him to the super specialty hospital in Delhi, in Mumbai, and unfortunately, my 5-month-old baby uh, could not leave. So the baby had a health problems, and those were, horrific days. And after 3 years, my wife, my lovely wife, she died of brain tumor,
Oh,
a very rare disease of in the brain, and I tried my level best to save a life too. So you understand that two deaths on trot. But wait, the story doesn't wait over here. Stop over here. My saga of suffering started when my mother, she died in 2006. So, kid in 2000, my wife in 2003, and uh, wife, my mother in 2006, because of intestinal lung disease, which has no cure in London as well. And in 2007, I lost my biggest pillar of my life. That was my father. But my father, before going, asked me a question one fine morning. We were all talking at a breakfast table. He said, "Now, this is your house. Once upon a time, this house was full of people. It was a joint family system. And then you got married, and we were all happy. The kid is no more. You have lost your better half. I lost my better half," he said. And then, now, how are you going to survive? Why you want to survive? And what is the objective of your survival? So I gave him a very nice answer. I said, "See, have you seen the old banyan trees? Or have you seen all those, जैसे एक वट वृक्ष को आप देखते हैं, वो क्यों जीता है? Because he wants to inspire the little ones. So अभी एक बहुत बड़ा पेड़ होता है, बहुत पुराना हो जाता है, उसकी जड़ें भी, लेकिन वो लोगों को छाव देता है." तो मैंने कहा कि मैं लोगों को ये बताना चाहता हूँ कि इसके बावजूद कि मेरी जिंदगी में इतनी सारी तकलीफें आई, उलझने आई, और आती रहेंगी, मैं अकेला लोगों को ये सिखाऊंगा कि जिंदगी वापस नए सिरे से शुरू हो सकती है.
mm,
After that, I started teaching Govinda, then Sri Rajpal Yadav, Pankaj Tripathi in 2014 and 16. I taught him during Mango Dreams, because Mango Dreams is the only movie he has done in English. That's because of me, I would say. And there are photographs which I will send you after the Zoom meeting to my dear friend Ranjini, who's doing such a noble work in such a noble profession she's into. A woman of great gumption and valor, I would say, rather, because she has taken up the responsibility. She is being saddled with the responsibility to uh, give everyone, some sort of joy in life. Okay. During when my son died, still I was teaching. I'll explain you an experience. One day I was teaching a boy who was a case of pseudomuscular paralysis, a very rare disorder, and his father paid me some money. And I was not in a position to, or a state of mind to teach this young kid, but still I was pulling on all my courage. I gathered all my courage and I was teaching him. And somehow I got some sort of tingling sensation in my legs. Okay,
mm,
so I told my father that something is happening to me as well. All right,
mm,
and then I took a break, and then I got inside my bedroom, and then I slept for some time, and I asked the child, you give him some cup of tea or offer him some biscuits. I'm not bit feeling I feel under the weather. I am not feeling myself. I feel little off color. But then I don't know what happened to me. I suddenly started that I am facing some impending doom. And then a time came that my heart rate was more than 140 or 150. So my father and my mother, they were all scared. And they started thinking, what is happening to him? Like, is it a cardiac arrest or something? Then the doctor, my family doctor, was being summoned, and then he checked my blood pressure. It was okay. It was between 150 and 160. But then he said that his heart rate has gone up. And that is the reason this could be a cardiac problem. So I was immediately shipped to a cardiac room, and one of the known cardiologists, he started checking me up, like some of the symptoms, whether I got a stroke or cardiac arrest. But then he checked, he did something on my legs, and I pulled my leg back. Then he said, there's nothing happened to this gentleman. See, this is called an acute panic reaction. Now, I was not knowing what is acute panic reaction those days, because that was a new something new to me. And then he explained, my brother, tell your brother that he's not cardiac. This does happen purely because of some no apparent reason. This is a reaction in the body. And there are certain glands in our bodies like dopamine, endomorphine, serotonin, and there is another gland that's what we call adrenaline. So there was a surge of adrenaline, and sudden surge of adrenaline were making the things worse. And that was the reality, because it's like if you're in a jungle and if you see a lion, what is going to happen to you is there'll be three reactions: freeze, flee, or fight. So those reactions. Now, I had no jungle, I had no lion. Still, my body mechanism was working against, like there's a tiger or a lion in front of me. So for 3 years, I was eating tablets because I used to get frequent panic attacks. So panic attack, you know what is panic attack, gentlemen?
Mm-hmm. Yes, it's like anxiety, right?
No, you don't not only feel restless. If the symptoms of panic attack and heart attacks are same, it's like
Mm-hmm.
you get palpitation, you feel like impending doom, you feel like you may die, and you feel claustrophobic,
Mm-hmm.
and you feel like you want to commit suicide because you feel that you feel. I see. Situation is like you feel you want help and you don't want help, so you're caught between devil in the deep sea. You're in catch 22 position. Then I was because I was on alprazolam, a dose of uh, uh, they give you some sort of drug that is a depressant. That drugs makes your the thought process a little slow. All right.
Mm-hmm.
Then I was given the drug, and I was getting because those panic attacks used to come for no apparent reason. And if you scientifically study what is called panic attack, it
Mm-hmm.
comes for no apparent reason. Then
Acha.
I met one of the biggest psychiatrists in Mumbai,
Mm-hmm.
and then he asked me, "What do you do?" I said, "I'm a teacher." I said, "Okay. So what is this problem?" He said, "Rajesh, if I tell you that you don't have any problem, will you accept it?" I said, "No, not at all, because I'm getting suddenly I feel start feeling shaking. I feel I perspire. I feel I cannot attend cinema hall because I feel like there is a chest pain in my heart somewhere, and I feel like running out from the cinema hall." I said,
Mm-hmm.
and then he said, "Okay, Rajesh, now try to understand what is panic attack. Panic attack is not a heart attack. If panic attack comes, you are not going to die. Okay, and panic attack requires no treatment. But what is
Acha.
your problem is right now you're on tablets. You want to cut off the tablet, you want to taper it off, then you have to do it very slowly, gradually." I said, no problem. I was on 3 mg those days on those alprazolam. You can, see the drug, alprazolam.
Okay.
Then what did he do? It was one of the most classic example, and there was a two crucial days he worked on me. He put me on a tablet which was zero point 0.5, and he asked me to eat half, 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 half. I reduced my dose. Okay, dose. He reduced my dose considerably to a considerable extent, and he was observing. And those were the 2 days where I was going through turmoil, absolute turmoil, because I was feeling like my hands were shaking, the body was perspiring, and I was literally shaking. I was asking for drug, and my parents, my wife, they were not giving the drugs to eat. And after 2 days, I started shouting at doctor, and I said, "You are here to kill me." He said, "See, it was just 2 day observation. Did you die by eating less tablets?" I said, "No." Did